and more kids in emergency rooms. Everywhere, hospitals are running out of beds for them, and winter isn't even here yet. Parents worry that if their kids get sick, they might be denied care. Instead of bickering, when are the Liberals going to take this situation seriously and do something to protect our kids? The Honourable Minister of Health. Thank you, Mr. Speaker. Obviously, we're very grateful for that question. The first thing is that our children and seniors and families are going through tough times. There are viruses cutting through the population at an alarming pace. We're not done with COVID yet. The hospitals are still dealing with COVID and RSV and flu. It's going to be a bad year for those things. So we do have a responsibility and a duty to take care of one another, and that requires mass vaccination and other public health measures.
They want to know their kids will be taken care of when they get sick. Across Canada, there is a children's Tylenol and Advil shortage, and now hospitals are dealing with a lack of pediatric antibiotics. Mr. Speaker, it's a scary time to be a parent, and there are things this government can do now. Instead of vague promises and pointing fingers, the Liberals must ensure our kids get the medicine they need. Parents are desperate for help. Where is the plan to care for our children?
The Honourable Minister for Health.
Thank you, Mr. Speaker. Families and children are indeed living through stressful times today, and that's why we were pleased to announce just a few hours ago that there will be a special importation of additional analgesics, the equivalent of several months of normal supply, in addition to the increased domestic production of these analgesics, so that children and their families can have access to those drugs in the very short time, and therefore we'll keep working on a longer-term solution to these shortages. Thank you, Mr. Speaker.
The Honourable Member for